Hello, I'm Karen Griffin, the Chair of the Program Committee for the Joint Hypertension Scientific Sessions 2018. And I'm joined this evening by Dr. John Bisognano, who is the immediate past president of the American Society of Hypertension and now Vice Chair on the Council of Hypertension, and Dr. Jan Basile, who is the Vice Chair of the Council of Hypertension for Clinical Programming. Our meeting this year is primarily focused on hypertension research and clinical practice. The science that has been submitted to this meeting has been really up to date on the developments of our understanding of the causes of hypertension, the mechanisms of target organ injury, and the most effective means for the detection, evaluation, and management of high blood pressure across diverse populations. Our first opening lecture tomorrow will be given by Dr. Jan Basile, in which he will spotlight some of the highlights of the new hypertension guidelines. This will be followed by recent advances in hypertension, in which experts in different areas of hypertension will present data looking at the relationship between hypertension and its relationship to a stroke, obesity, genetics, kidney, and cardiac diseases. I think with that, I'd like to ask Dr. Bisognano, since he's been very involved with the partnering of the American Society of Hypertension with the Council of Hypertension, why people who have been members of the ASH Society would want to come to our council meeting.
Thank you, Karen, and I want to welcome everyone to this meeting. The American Society of Hypertension is very happy to be partnered with the American Heart Association, and this meeting really is an unusual gathering of people from all aspects of the field of hypertension, from research to clinical practice to public health. And the members of the American Society of Hypertension have a lot to gain from this meeting. The ACC and AHA new guideline for the treatment of hypertension has come out just a little under a year ago, and techniques to reaching these new goals will be discussed, and barriers to reaching these goals in our patients will also be discussed in great detail. Another focus will be on patients with resistant hypertension, who are an ever-growing part of our population. So there's a huge potential to learn in this meeting, and also to learn of some of the basic science and other research that's in the pipelines that will probably change the way that we treat hypertension in the future.
And I'm very excited to be here as well as a past ASH member and now a proud member of the Council on Hypertension. We have a great meeting in store this year. We begin with a clinical practice, clinical science track that highlights the tracks on basic science research in hypertension. Our clinical practice, clinical science track will feature a highlight Thursday afternoon on aldosterone and its importance in hypertension. We'll talk about special populations at risk in hypertension. Friday afternoon, as we've done for the past 8 years, we'll begin our primary care track in hypertension, which really is reaching out to the primary care clinicians in this country that take care of the majority of hypertension. And we'll talk about important issues for them on translating the science into practice, how to improve blood pressure control. We'll talk about the different guidelines that have come out, not only the ACC, AHA guideline that John mentioned, but the European guideline, the Australian guideline, the Canadian guideline, and we're going to highlight all of those. In addition, we're going to talk, like I said, about special populations. Primary care continues Saturday morning. We'll have some patient unknown presentations, get the audience involved, our colleagues, as well as the panel. And then on Sunday morning, we're going to talk about special populations in hypertension and translating to improving blood pressure control. So between the clinical practice, clinical science, the primary care, the overall meeting, this is the best hypertension meeting in this country that people should come to. We've worked very hard to bring you a good meeting, and I hope you'll be part of it.